Okay, next.
Respected dignitaries on the dais, off the dais, and delegates. A very good afternoon to all of you. My topic of presentation today will be ophthalmic manifestations of mucormycosis, our study. Mucormycosis refers to a rare, severe opportunistic infection with fungi of the order Mucorales. Mucorales have an intrinsic ability to invade the blood vessels and can affect different parts of the body. Cerebro-rhino-orbital mucormycosis is most common and most aggressive form. Uncontrolled metabolic conditions, especially diabetic mellitus, is the main risk factor. Mucormycosis is a rare fungal infection. The incidence in India is much higher. Affected individuals may have poorly controlled diabetes, metabolic acidosis, or immunocompromised states. Mortality remains high despite advances in diagnosis and treatment. 10 cases of mucormycosis were examined. 8 cases had orbital findings. Detailed history taking, ophthalmic examination was done, visual acuity, slit lump examination, intraocular pressure measurement, contrast enhanced CT scan, MRI orbit was done. Associated systemic examination was also done, temperature measurement at regular interval of time, urine examination, blood sugar test was done, and the results were analyzed. Lid edema was present in 7 cases. Chemosis, periocular edema, facial edema, discoloration of the lid, discoloration of the face were found in 4 cases, and proptosis found in 5 cases. Ptosis, ocular motility restrictions, diplopia, facial palsy, and ocular pain was the varieties of ophthalmic manifestations. COVID-19 history was present in all the cases of mucormycosis. Uncontrolled diabetes was present in 5 cases, and controlled diabetes mellitus was present in 3 cases. There was no history of malignancy in any of the cases. Very poor general condition was associated in 1 case, and hypertension in 3 cases. Visual acuity was more than 6/24 in 6 cases, and 6/24 to counting finger 3 meters in 6 cases. PL negative in 4 cases. This is one of the case where the general condition was very poor, and these are the associated with lid edema, facial edema, pain, proptosis, with a very poor general condition. And retroorbital amphotericin B was given 3.5 mg per ml in 5 cases. Liposomal amphotericin B was preferred. Pre-injection Avil and paracetamol was given. First test dose was given 1 ml containing 1 mg without pre-medication. Hypersensitivity reaction was watched for 30 minutes, and then 1 ml of retrobulbar injection containing 3.5 mg of amphotericin B was given. Posaconazole tablets were preferred, 300 mg 2 times a day on for day 1, and then 300 mg OD on day 2 onwards in all the cases. Exenteration of orbit was done in 1 case. Entire eyeball and the surrounding structures including muscles, fat, nerves, and eyelids were removed. Dressing of the orbital cavity was done frequently. Skin grafting was given. Posaconazole tablet 300 mg twice daily on to start, and then 300 mg OD was given. This was a case which presented with restriction of ocular movement, ocular pain. Patient was COVID positive 3 months back. CT scan of orbit revealed orbital mucormycosis. So there was ptosis in the cases, there was ptosis and restriction of ocular movement. Lid edema was not much. Facial pain was there, but facial edema was not much. So this is the view of the patient after exenteration of the orbit. The orbital cavity was subsequently skin grafting was done. All the extra ocular structures, the eyeball and the muscles, orbital fat, everything was removed, and the in the bony cavity skin grafting was later given. This is the view after giving the skin grafting. This is a histological feature of the mucormycosis mass. The mucorales were found in the section. So exenteration of the orbit and debridement of the sinuses. So the surgery was conducted along with the help of ENT department, where debridement of the sinuses was done simultaneously. So rhino-orbital cerebral mucormycosis is a very severe opportunistic fungal infection. The destructive exenteration is life-saving. Retroorbital amphotericin B, posaconazole tablet is helpful. Thank you for